Prior to mobilizing a critically ill patient in the intensive care unit, it is important to ensure that all of the lines are positioned appropriately to facilitate a smooth and safe mobility event. With extra care and awareness, we can mobilize patients who have endotracheal tubes, central venous catheters, and arterial lines. Best practice is to mobilize towards the ventilator. For some patients, both occupational and physical therapy will work together in a combined session to improve safety, to facilitate normal movement patterns, and improve functional performance. Before mobilizing the patient, we will typically perform a simple muscle strength screening. This is different from a manual muscle test, which we will discuss and demonstrate in a later video. This simple screening is a quick and easy way to assess general strength level and identify any areas of notable weakness. It also gives us an idea of how much physical assistance the patient may need to mobilize to the edge of the bed. A more thorough strength test will be performed once the patient is sitting on the edge of the bed. After our initial screening, we will work on getting the patient to a seated position on the edge of the bed. Instead of dependently mobilizing the patient to an upright position, we want to ensure that the patient is as actively engaged in as much of the bed mobility as possible. This may be as simple as giving the patient more time to process and respond to our cues in order to move their own body, or it may require a more hands-on approach, such as helping the patient bend their knees and maintain an appropriate position for effective bridging, or helping to initiate rolling. Once the patient is in a seated position, therapy will work on facilitation of upright posture to activate the trunk and abdominal muscles, provide optimal positioning of the scapula and shoulder girdle to allow for functional use of the upper extremities, and to optimize breathing. From the edge of the bed, we may incorporate sitting balance and trunk strengthening activities, such as moving laterally and forward and backward over the base of support, and also resistive exercises. For some patients, just sitting at the edge of the bed and working on upright posture is all of a physiological challenge that they can handle. For those patients, we might incorporate weight bearing through the forearms on a bedside table into the treatment session. Weight bearing through the forearms provides increased stability by providing a larger base of support and promoting proximal stability. This position also provides better use of accessory muscles to accommodate the work of breathing and allows the patient to bring their trunk forward over the hips in a way that may be less fear-provoking. For those patients who are stable both physically and physiologically from the edge of the bed, we may progress to pre-transfer and standing activities.